All right. We are live, and today we are talking about hidradenitis suppurativa. I'm gonna wait just for a few seconds for people to come in, and then we are going to start. I have to apologize early. If you look at if you know my background, you know that I am in a different location. So if you hear noise, some little guy making noise, I am sorry. I apologize in advance. Please let us know where you're watching from, and don't forget to like, share, be interactive, ask all the questions that you have, and we will begin. Let us know, be interactive, be interactive, be interactive. All right. I hope you guys can hear me well. Okay, so let us begin. Like I said before, we are going to be talking about hidradenitis suppurativa. Let's go. Okay, so what is a hidradenitis suppurativa? This is also known as acne inversa. It's an inflammation of the sweat gland, and because of this inflammation, it causes like small, painful lumps to form under the skin. Because the sweat glands, also known as the apocrine glands, are blocked, it causes the rupture of that gland. That's why most of people you'll see like little bumps and swelling under the skin that will eventually pop. Sometimes it brings out pus. It forms most especially on areas that the skin folds rub together. Example like the armpits, the groin, the buttocks, the breast area. Those are the most common places where these lesions form. The lumps heal very, very slowly, and it can recur. So the problem with it is that it comes on often, on and off, and on off. Is very, very common in Black people, especially, most especially women, and this can lead to tunnels under the skin and cause scarring in the area where it frequently occurs. Risk factors and incidents. It is again most common in Black in puberty. It starts in puberty to the age of 40. It affects more women than men. Another risk factor for this is obesity, diabetes mellitus. Diabetes causes high insulin resistance in people that have this, and vice versa. So if you have this, you are at an increased risk of developing diabetes. Also, if you're a smoker, smoking will cause poor medication response to this issue, and that's why we've also talked about smoking a lot. I believe a lot on this channel. Smoking causes a lot of health problems, so it's the best thing to do is just quit smoking. If there's a family history of this disease, then you likely, or someone from the family will likely have this issue too. So, what are the symptoms of HS? Symptoms include blackheads that appear small in the areas of skin. Often they come in pairs. Okay, you will less likely see these painful bumps by itself. So they come in pairs. Again, they cause painful bumps under the skin. It can persist for weeks or months. Most of the bumps actually form later, but they usually where there are more sweat and oil glands, or where the skin rub against each other, like I said before. Um, Another symptom is leaking bumps or sores. Like I said before, when the sweat glands are clogged, they eventually will rupture, and then it will cause leakage, like pus to drain. And most of the times, this pus will also have an odor. Tunneling. So over time, because of the frequent recurrence of this skin infection, tunnels will appear under the skin. They are just like tracks under the skin that are connecting where areas that we're connecting those lumps together. And again, this wound heal very, very slowly. And again, they drain blood and pus. So these are examples of pictures of hidradenitis. Like I said before, you will usually find this around the breast area, in the armpits, the buttocks, and the groin. Again, mostly where the skin rub off on each other. This is another one. This is a mild one. The first circle here is a mild form of this. Then there's the moderate one where you can see the lumps are a bit more pronounced. And then there's this one with a lot of lumps in tracking. This is what the tunneling looks like. I mentioned earlier tunneling under the skin. This is what they look like. It's basically a tunnel of the tracts of the lumps that are lined together under the skin. So this is a more severe example of hidradenitis, and again, it's usually under the armpits, in the groin, around the breast area. I see this a lot, especially in the groin and under the armpit. So if you do have this frequently, what are the things that you can do to prevent? Number one, avoid wearing constrictive clothing. Because remember, I said that it occurs most often in areas where the skin rub on each other. So if you wear something that is really, really tight, it's going to cause a lot of friction. And then sweating also, because remember, it's the painful, is a clogging of the sweat glands. You can lose weight because one of the risk factors, as we discussed earlier, was obesity. So losing weight can help in preventing this from happening. Good hygiene, keeping yourself clean, the areas dry will help this from recurring so often. I mentioned quitting smoking. So if you're smoking, it would be a really, really good time to quit, or good idea to quit, because also um, smoking, like we said, constricts your vessels. So if your sweat glands are getting clogged and causing these painful lumps to appear, then you definitely must quit smoking. There are things also that can your doctor can prescribe that can help this from recurring often. An example is a topical clindamycin. Topical clindamycin is a topical antibiotic, same thing with chlorhexidine. 4% is a topical antibiotic cleanse that you can use to cleanse the area that occurs frequently, where it occurs frequently. So you would wipe those areas down, maybe daily, up to a point where maybe you're wiping it down like once a week or so, or even once every 2 weeks, depending on the frequency. So home remedies that you can do, continuing, things that you can do by yourself, also includes gently washing your body with non-soap cleansers. Especially women, we love a lot of things that have perfume. Those things are irritants and can cause this thing to occur if you're one of those that are having this frequently. And also, when you're washing, avoid using washcloth, especially the hash washcloths, loofahs, or other things on the affected area. Do not scrub, do not rub on those areas, because what did we say? Most often occurs when the skin rub on each other. So that's not what you want to do, because they can irritate the skin. Do not squeeze the pimples and sores. It is very, very tempting to do so, but endeavor to stay away from squeezing the pimples. Avoid shaving or using creams that again have a lot of perfume and things like that. You can manage your pain gently by applying a wet warm cloth in those areas. So warm compresses will allow the blood flow in that area to increase. It will reduce the swelling and ease off of the pain that you're feeling. You can also take stuff like over the counter Tylenol to help you with the pain. Try to keep a healthy weight. We talked about this already. Stay active by exercising, eating healthy, because if you're not healthy, it can worsen the symptoms of hidradenitis. Consider altering your diet. There are some foods that can cause these symptoms to be worsened. They include dairy, red meat, food that have high glycemic index. So if your diet includes these types of food, make sure that you cut down on those. Consider talking to your doctor, or if you have a nutritionist, talk to them about how you can eliminate those things out of your diet. Again, if you smoke, try to quit. Smoking cessation has the potential to ease the symptoms and reduce the frequency of flare-ups. There are several medications that are used for treatment. Examples are antibiotics. I talked about it earlier a little bit. So the topical antibiotics that you can apply on the skin are very necessary for the mild symptoms. Um, and it can also prevent this from becoming a widespread disease and also reducing the frequency of it happening a lot. If that doesn't work, or if it's really, really severe, in such case, your doctor may prescribe oral antibiotics like doxycycline for a few weeks to help you, or for about a week or a few weeks, depending on how severe it is, to help reduce the symptoms or get rid if there's a secondary infection. Also, for some really, really, really severe case, your doctor might consider steroid injections like triamcinolone or Kenalog to that area to reduce swelling and inflammation. Hormonal therapy, so hormone pills such as estrogen, combined oral contraceptives can be very, very effective in reducing the symptoms and helping you from having too much too much occurrence of this, because remember, this is basically a hormonal imbalance also. Pain medication like over-the-counter pain medication can help you to deal with the pain. So there are other things that you can do that are a bit more invasive, and again, you need to talk to your provider about this. And those include uncovering the tunnels, the tunneling that I talked about earlier. So this procedure basically involves removing the tissue to expose. So removing the tissue on the skin to expose the tunnel that are under the skin. This procedure is used for people that have moderate or severe hidradenitis, and it doesn't have to be repeated once it's done. That's it, one time. Another option is a laser therapy, which uses a carbon dioxide laser on the skin to reduce the sores or make the sores go away. After this treatment, also, most cases, the sores don't return, and it can definitely help reduce this issue in the early stages. Another thing to be considered is surgical removal. So this can be an option with people that have frequent, persistent, severe symptoms of hidradenitis suppurativa. It involves removing all the affected skin. So a skin graft may actually be used. A skin graft is basically removing a tissue or skin from another area of your body and applying it to a different area to help close the wounds and help that area to heal effectively. The only thing is that even after surgery, the lumps and or the sores might appear again in a different location. Incision and drainage, IND, is a surgical drainage of the sores. Okay, it's not really considered very effective anymore because again, it comes back, it can lead to infection. It doesn't really provide a long-term relief of this. It is considered to be a short-term kind of relief, but afterwards, the sore usually will flare up again. So these are my references. Um, if you guys have any questions, please don't hesitate to ask. If anyone has questions, you can ask. If not, you can always send me any questions that you may have concerning hidradenitis suppurativa. And if you would like to discuss anything else in the future, please just send me a message, or you can find me on Instagram at IndieSpeaks_TV. You can find me on Facebook at IndieSpeaks TV, at YouTube at IndieSpeaks TV. Send me questions. If there's something that you would like to discuss, if there's something that you would like me to talk more about in details, please do. I would definitely um, do as much as I can. So that is all that I have for today. Until next time, join me June 11th. I'm going to be talking with Revan. Revan is a registered nurse. She's an RN. She's going to be talking about sexually transmitted infection. She's going to be talking about PEP. PEP means post exposure prophylaxis. So if you're exposed to, say, HIV, what can you do about it, and how much time do you have to do something about it? PrEP is pre-exposure prophylaxis. It's things that you can do to prevent contracting HIV. And we'll talk in details about different types of sexually transmitted infection and what you can do to stay away from getting infected, or what to do after, at if you do get infected. So join me then. It's going to be June 11th, which is, I believe, next Saturday or Saturday after next, at 12 p.m. on YouTube and Facebook, 12 p.m. Eastern Standard Time. Until then, you guys have a blessed week. Happy June. See you next time.